Welcome to another episode of the Treble Health Podcast. This is Dr. Ben Thompson. I'm here with Dr. Michelle Neidleman Kennedy. We're about to get into 3 commonly asked questions about tinnitus. Number 1, is my tinnitus permanent after 3 months? Number 2, will my tinnitus ever go away? And finally, number 3, when is tinnitus permanent? If you have not already, make sure you are subscribed to this YouTube channel where we cover the details and provide comprehensive knowledge for tinnitus. Dr. Michelle, let's get into question number 1. Is my tinnitus permanent after 3 months?
Definitely not. I know it can feel like a very long 3 months, but it is not permanent after 3 months by any means. In fact, I would say tinnitus is never truly permanent. You can always learn how to habituate to tinnitus, and you can learn different methods and techniques that help make it more manageable. So I would say absolutely not. What's your take on this, Dr. Ben?
Yeah, 3 months is, for most health conditions, such a long time. Imagine being sick. Imagine having an injury to my body. Imagine having something going wrong with my eye or my tooth. After 3 months, I would start to think, gosh, this might be forever because this is a long time. But for tinnitus, the timeline that we see for getting better, for improving tinnitus, for reducing it, it's on a much longer time window. So from our side of things as audiologists, we say, oh, 3 months. Okay, that's just the end of this, what's called the acute phase, where there is a chance that it could have gotten a lot better in the first 3 months. And that's probably why our community is asking this question of, is it permanent if I've had it for 3 months? So understanding that the time window is actually so much longer. Like, for example, Michelle, when you are working with telehealth patients, when you're helping them reduce tinnitus over time, what are the major time windows that you discuss and you educate on?
Yes. So I oftentimes remind them that it can take anywhere between 6 to 18 months to truly habituate to tinnitus. And that's not always from the initial onset of tinnitus. That's actually from the start of getting help, starting to implement tools and strategies on a regular basis. So you may have had tinnitus for a few months before finally reaching that point of actively trying to do something. And then from that point onwards, we would say, it's likely to habituate within 6 to 18 months. But again, it's important to remember that it's a bell curve. So there are individuals who may habituate before the 6-month mark, and there are individuals that may habituate even after the 18-month mark.
Yeah, so the 3 months is an important time period from my perspective, because my advice typically is, after someone has had bothersome tinnitus and it's been 3 months and hasn't gotten that much better, then it's time to step up the treatment, to take it to the next level, really to do everything we can. Because the trap, or what not to do, is say, oh, it's been 3 months, I'm going to wait another few months. Oh, it's been 6 months, let me just wait a bit more. And then suddenly it's been 8 months and you've been struggling the whole time, but you haven't invested your time, energy, resources into doing something about it in a comprehensive way. And that's something that we want the community to be aware of, okay, be careful of that. So you can take a 3-month time window of saying, I'm going to use basic sound therapy. I might try to manage this on my own. I might try to get some help for sleep. But if it's been 3 months and one is still struggling, that's when I feel our service or a similar service to take it to the next level is really useful. And hopefully this information answers that question of, is it permanent after 3 months? The next question we have from the community is, will my tinnitus ever go away? Dr. Michelle, what are your thoughts on that?
I absolutely think it can go away. There is a lot of tools and strategies that if you start to regularly implement them into your everyday life, you're going to start seeing improvements. I also do think, kind of piggybacking off of the first question, that at the earlier stages of tinnitus, if you start to seek treatment or start to use tools and strategies, I think that those individuals are the ones that we see eventually habituate much sooner, because it hasn't really imprinted strongly in the brain, in the body, in the mind. And so once you start using the strategies like sound therapy, holistic methods of relaxation, start doing things like physical exercise, meditation, trying to work on your thoughts and feelings, all of those things really help to combat tinnitus, and combat it in such a significant way when you are, especially in the earlier stages, but definitely at any stage along the tinnitus journey. And so tinnitus does take time, but it can eventually go away.
Yeah, at Treble Health, we have been trained by a prominent ENT who specializes in tinnitus. And that ENT came to us and discussed the different subtypes of tinnitus and how certain subtypes, the tinnitus can really go away. Now, other subtypes, it may not go away, but it can be reduced to such a manageable level that it doesn't affect your life anymore. So there is this confusion of generalizing all these different subtypes of tinnitus, basically the different causes of tinnitus, and generalizing them with a broad stroke. So to say that all tinnitus can go away, it's inaccurate. Some subtypes of tinnitus can get to the point where they go away, and particularly somatosensory causes, oftentimes related to the jaw, the neck. Certain kinds of stress-induced cases can go back to essentially zero, but often one still has a low level perception of tinnitus in very quiet places. So we always have this discussion of what's the goal of working with our patients. Well, the goal is to get the tinnitus as low as possible so it's manageable and your life can go back to normal. If as a byproduct of that, it goes away, then we celebrate it. But Dr. Jastrov with TRT, for example, tinnitus retraining therapy, one of my mentors that I trained with made it very clear that silence is not the goal. That this idea of chasing golden silence is doing more damage. It's a net negative, and we should instead try to get this to the point where it's manageable.
I agree. I think sometimes the term going away is relative. Does it mean the sound, or does it mean the annoyance, or does it mean the general awareness of it? And many of those things can happen as we do learn to habituate and eventually do habituate to tinnitus, but the sound of tinnitus may still remain, but the overall perception awareness of the tinnitus is basically gone each day. So it's as if it wasn't on your forefront or of your mind as it once was.
So let us remind and hold up this signal of hope for the community here that tinnitus can get better. And especially if you're in the earlier stages of this, we need to not freak out. We have to not get in our own way and trust the brain can habituate any type of signal, but in our specific situation, reduce and habituate the tinnitus. This is transitioning us to our next question, which is, when is tinnitus permanent? So are there certain cases where tinnitus is always there or never changes? When is tinnitus permanent? Dr. Michelle?
I would say that for the most part, all individuals are able to have some neuroplastic or brain changes occur that allow us to not perceive the sound of tinnitus to the same degree as we once heard it. And so for most individuals, you can get to a better stage. And so the present status of your tinnitus does not have to be permanent. There are things that can improve so that the overall volume of your tinnitus may decline. The overall awareness of your tinnitus may also decline. The overall annoyance and bother that tinnitus causes for you may also decline. So the current stage definitely does not have to be permanent. With the right tools and strategies, tinnitus can improve and doesn't have to be exactly as it was when it was its worst.
So it is common for someone who has tinnitus to have it for their whole life. That is common. To what degree it impacts them, to how severe it is, that changes significantly. So, for example, my tinnitus, I expect to be permanent, meaning that as long as I am here on this earth, I will hear tinnitus in a very quiet place, like going to sleep at night or being in a very quiet room or being in nature when there's no sound outside. I will hear the phantom sound coming from my brain. I expect that to be permanent. However, for those who have a much more intense spike of tinnitus, meaning they had little to no tinnitus before, and now they're going through this intense period of time, I expect that to fluctuate and change, which goes back to our previous comments and previous discussions already in this video, that tinnitus may not completely go away, but it gets better to the point that you can manage it. So the nuances of the communication here are important, because if one of our patients, Dr. Michelle and I, if we see one of our telehealth patients with Treble Health and they're having thoughts or losing hope and thinking things like, my tinnitus will never go away. It's already been 3 months. This is going to be a curse for the rest of my life. This is permanent. I can't manage this. It's inaccurate thought. and we can replace that kind of thinking pattern with a more realistic and science-backed approach to this, what kind of negative thinking comes up when you're doing telehealth sessions, Dr. Michelle?
I oftentimes have patients express concern that their tinnitus is just going to continue to get worse, whether it be the overall volume of their tinnitus or the duration, meaning like how many hours of their day they're actively aware of their tinnitus, that's just going to continue to increase over time. I also have a lot of patients worry about how it's going to impact their ability to live their life fully and in a happy way, because they can't imagine sometimes doing some of the things that they find enjoyable with tinnitus being in their mind. So oftentimes I will remind them that tinnitus can change. Again, the status of your tinnitus at this day and time, there's no hard set rule or law that this is how it's going to be from this day onward. So the volume, the annoyance, the awareness, all of those can change and improve over time. And even if we do have tinnitus with us, we can still learn to enjoy the small things, the big things in life. There's many examples of everyday activities that we do where there are sounds present in our environment and they don't negatively affect our ability to enjoy the moment. So for example, you may be going to the park and it's the same day that they've decided to cut down some trees. You might be enjoying the company of your grandchildren or your children or your friends and so engaged in that there are only few moments of the day that you're actually aware and actively hearing the tree cutting happening. And that, if you were to focus on, is a very loud sound and a very constant sound. So those are some of the examples of things that I tell my patients to help them start to understand that regardless of the permanence of tinnitus in their everyday activities, they're still able to enjoy the things that they want to do. And we can shift our focus and attention so that despite the presence of tinnitus, it doesn't impact our ability to enjoy our lives.
There you have it, guys. Thank you for watching this video. If you're not already, please do subscribe by finding the button below. And on the next screen, you'll see some different videos that you can click that will give you more information here that I believe will help you. This is Dr. Michelle and Dr. Ben with Treble Health. We have an online telehealth service for tinnitus management and treatment. Thank you for watching this video, and we'll see you soon. Bye.
Bye.